Welcome back to Inspire Great Health. I have Dr. Rifai with me today. He is a cardiologist at the Heart and Vascular Institute. How are you today, Dr. Rifai?
I'm good. How are you?
I'm doing wonderful.
Thanks for having me.
Of course, I appreciate you being here. Today we're going to talk about the Hearts Stronger Together support group. So let's jump into it. What is the Heart Stronger Together support group?
So it's kind of support group for the community because we have a high patient population with heart failure. So we decided to have some more education about specific topics regarding heart failure with multiple specialists that show up to that support group.
When does it take place?
So we are trying to make it happen every other month on the third Thursday of that month. It's going to be our first session this month on the 17th. And it's going to happen, as we said, in the hospital in the one of the auditorium there.
And it's to support people with heart failure, as you said. Let's kind of get into what heart failure is. Can you explain it to me?
So the heart is considered as a pump that try to eject blood to the organs, the brain, the liver, the kidneys, the bowels, all the organs. And at some point in life, if we have the heart failure diagnosis or the disease, it's either we have a failure of this pump to eject appropriately the blood to the organs, or this pump becomes a bit dysfunctional and stiff, where it's not working or functioning as it should be.
And there are two different types of heart failure. Is that correct?
True.
What are those two types?
So they are the systolic heart failure, which means that the pump is weak. And there's the diastolic heart failure, which means that the pump is still squeezing well, but it is not relaxing all the way in order to accommodate all the blood that it needs to.
Who's at risk for heart failure?
So we know that the number one risk factor for heart failure is underlying coronary artery disease, which means blockages in the vessel that supplies the heart. So heart attack, blockages in these vessels. That's the most common reason for people to have heart failure. The other high-risk people are people that have chronic high blood pressure, especially if it goes untreated or undiagnosed. People that have chronic type 2 diabetes or even type 1. And especially if it doesn't go treated. So these are the three main categories. There's other people at risk for that, people that smokes, people that have obesity or morbid obesity are risk for heart failure too.
So how do you prevent it? Is it just managing your weight, quitting smoking, things like that?
So if we kind of catch the disease early in the process, as we said, high blood pressure, if we catch it early, or diabetes, and we do some intervention about that, control these diseases, this way we prevent the heart failure from happening or even progressing. And definitely the other things that we have control over, as the lifestyle, as you said, stop smoking, exercising more, losing the weight. So all of these also prevent you from getting there to heart failure.
And even with someone who has heart failure, how can they improve their quality of life as their disease progresses?
So nowadays we have a lot of technology and a lot of help for our patient in order to make them live as normal as we can with the least symptoms. So definitely, having a specialist that you go see, getting on the right medication. There's a lot of new medication that have been and more approved for heart failure that helps with that. As I said, getting treated for your blood pressure, for your diabetes, getting you on an exercise program, meeting with a dietitian that can help you figure out what food is appropriate and how to lose the weight. So we have a lot of resources and support for our patients with heart failure.
Is there anything else you'd like to add?
No, I'm just encourage everyone to show up to our meeting with the community, ask questions. We will try to have multiple specialists during this session, not only myself as a cardiologist, but we will have a dietitian at some point. We'll have someone from cardiac rehab, which is for physical activity. We will have a lot of people from palliative care in order to help. So there's a lot of resources and patients can benefit from that. So hopefully we will be able to answer a question and give good information.
And is the support group just for people with heart failure, or can loved ones attend as well?
Definitely, anyone who is interested, even if people that don't have heart failure, but they have it in their family history, or they want to know about it more, or know how to prevent that from happening. And it's for the patient and their family, because anyone with such diagnosis require a lot of support from people around them, family, friends, that they can help them go through that can support them and support their goals. So we really welcome anyone that want to show up.
Okay. Well, thank you so much. And it sounds like a great group, so we hope you can attend. Even if you're just interested in learning more about heart failure, it's the third Thursday of the month at 5, or every other month, on starting in April at 5:30 p.m. in Auditoriums A and B at Cheyenne Regional Medical Center in Cheyenne, Wyoming. Well, thank you so much for joining me today, Dr. Rifai.
Thank you.
Yes, I appreciate all the education I received today. And tune in next time.